What the heck is EMDR?
Yeah, it is a science-backed trauma technique that is very effective in helping people integrate trauma.
If you could solve one of the biggest misconceptions that they have about what a counselor does, what would you share?
Many people think we listen, and that's just it. That's a huge part of what I do. We're always tracking nonverbals, physiological symptoms of how people are presenting. It's a lot about helping people understand themselves, and the listening is all part of that. But I don't just listen to people.
Welcome to the Best of White Rock, where we sit down with the standout business owners, community leaders, and entrepreneurs shaping life here in White Rock and South Surrey for the better. These are their stories behind the people driving real change in our community. Hosted by me, Darren German of the German Group.
One of the things that really struck me about our intake conversation when we first were introduced to each other is just how passionate you were about what you did and how much you loved it. You're even smiling thinking about it, right? So what I would love for you to do is please introduce yourself to the community. Let everybody know who you are and what you do.
Yeah, absolutely. Thank you for that. My name is Melanie Huck, and I'm the owner of Rosemary Heights Counselling. I've been practicing as a clinical counselor since 2002, and really started out working with substance use and youth. And now I love working with couples and helping support relationships.
Yeah, and you've got a long history. You had a fascinating kind of entry into where you are today because you actually started out in psychology. Is that right?
Yeah, I was trained as a clinical counselor. I did a graduate degree in counseling psych, and then my first job was at Sources here, a local well-known nonprofit, and that's where I did some substance use counseling. And that was really an incredible experience in really understanding human beings and how we're all affected by difficult experiences, whether that's trauma, whether that's a predisposition to addiction, or even just a problematic use of a substance, and how everyone around that person is really impacted. So it was an amazing place to start my career, and I still use those skills today, all these years later.
Well, I'm sure it's got to be like a toolkit that you've gathered over the years, and you can pull out different tools at different times, which just make you so much more effective when you meet with people.
Yes.
Now, I was curious, like we're going to get into the counseling piece of things because that's really the fascinating piece about this. But how does one start a journey like that? So do a lot of people get into that, and does it start a lot with like addiction and youth and that sort of thing? Is that kind of like a gateway to get into that world, or what made you or caused you to kind of go down that lane?
Yeah, I think it's a common entry point into the profession. In order to be a registered clinical counselor, you have to have a graduate degree. And then from there, you can work in a mental health setting in the community. It's very rare, or was very rare, that clinicians would open a private practice immediately out of school. At that time, it's a little different now. And so working in a nonprofit is a pretty key entry point, and good way to get experience.
Yeah, for sure. And so when you first started your career, were you by yourself? Were you part of a team? Like, how did that all work out?
Yeah, so working at the substance use program at Sources, you're part of a team and you get supervision as well as program management. And then actually took time out to have a family of my own. And at that time decided to go into private practice. And so that was in 2012. And I joined a long-term private practice here called Bonnie Mason and Associates, and was there for 12 years. And so as my family grew, my hours grew at the clinic, and that's where I started doing youth work, and still love working with youth. It's very different than working with adults. And then over time decided to shift focus and work more so with adults and relationships.
What's the biggest difference between working with youth and adults?
Yeah, I think youth bring a certain kind of energy. I find youth to be quite forthcoming, which I think is surprising.
They're quite honest.
They're honest.
Yeah.
I think they just see it how they see it. And I think it's really a stereotype that every youth is difficult and shuts down and doesn't want to be heard. Most of the youth I would work with, the main thing they would tell me that they want is for their parent to hear them. is their parent to listen to them. And really, to me, we all want to be heard and we all want to be listened to. So there's a certain kind of innocence and energy that youth bring that I just really enjoyed working with.
So I would imagine that's got to be, I would have thought that would be one of the tougher ones because I would have made the same assumption about that. What makes somebody a good listener that you're able to pull things out of people? How does that?
Yeah, I mean, that's partly training, but for me, as the years have gone on, to me, it's just a very human interaction. And so I think there's a way that you work to establish a sense of safety in the room. People can feel when you're really truly engaged with them rather than just kind of listening to move on to the next question, if that makes sense.
Yeah.
And so I think I just work really hard to let them know non-verbally and verbally that I care about what they have to say and that I'm curious about who they are as people first. And I think that's just a feeling people can get, and which has been interesting, shifting into kind of more of a business person as well, to take that with me and prioritize that, but also how do you run a business, staying true to that too.
Well, totally. And you said the word safety. What causes somebody to come in and seek your help and they don't feel safe to begin with? Because I'm guessing they maybe show up with maybe almost like a little bit of a mask or a shield, and cracking that and getting them to actually talk and to feel listened to, as you said. Why do they show up like that?
Life experience. If perhaps they've grown up not feeling important, or whether that's a real experience they've had or their own perception, doesn't really matter. But for them, if they feel not important, not seen, not valued, these affect how we move through the world. If they have a perception that what I have to say or who I am doesn't matter, then they are going to find a way to learn to live with that and maybe put masks on and have a self-protection about them.
Yeah.
So a lot of times I find when people are engaging in therapy for the first time, I'm listening for those things, and maybe adapting my pacing and my line of questioning in accordance to that. And I always say to people, my goal is to help you feel heard and for you to leave here feeling just a little bit better when you came in. And so I don't have an agenda. This is a collaboration between us. And so they know that from the outset. It's really about meeting them where they're at.
Yeah, I love that. And you had mentioned that you actually find adults come in more so maybe with those shields on than the youth do. Why do we just grow that as we age? Do we get more reluctant or more hesitant to share or more protection?
Well, I will say, I think it depends on the person's life experience, what form of protection they may put on. But we all have them. It's part of the human experience. And again, depends on if the world has taught you that people aren't to be trusted, for example, or the world has taught you that the world is unsafe, people are unsafe, then you're going to find a way to engage in the world that fits your sense of safety and makes you comfortable. Human beings are wired for connection. And so we all want that. Whether or not we can access that in ourselves is kind of a different story. It's the idea of what has happened to you that has forced you to compensate in that way. And whether that means you avoid relationships and you avoid interacting with people, whether that means that you always need a relationship to feel okay inside. And then there's the spectrum in between. So, yeah.
So talk to me about the journey into your own business and getting into the counseling side of things. And you've got this incredible shop and this incredible team over at Rosemary Heights.
Thank you.
How did that all come about?
Yeah, well, it's an interesting story. I mentioned earlier that I was part of an established practice called Bonnie Mason and Associates. She became my mentor and now friend. And so it came time for her to move on from and retire, go into semi-retirement. And so she offered me the opportunity to take over the practice in 2024. So at that time, September 2024, I took over the practice and changed the name and did a whole rebrand, and really kind of underestimated what it would look like to be having a full-time caseload and working in the practice, and then also having a business on the side.
Yeah.
So that's been probably my biggest learning.
Yeah,
how to do both.
Going from working on the tools to actually working on the business.
Yes,
two different things.
Two very different things, especially being trained in the helping profession. We're trained to focus on the client care above all else, always. And of course, that's still the case. That's a really important part of Rosemary Heights Counselling, is making sure people are professionally and compassionately cared for. But we don't get any training on being a business owner, being a practice owner. So that's its own kind of learning curve that I've had to really get used to over the last year and a half. Yeah,
well, you look at what people are saying about your business, and it's such incredible positive things, and you've helped a lot of people. So whatever you're doing a good job. Keep going.
Thank you.
I wanted to get into a little bit about, there's somebody maybe listening to this and they're thinking, I don't understand the difference between like what is a counselor, or maybe therapy, or even we talked about your background studying psychology and whatnot. What are the differences, and how does somebody know that maybe what you guys do over at Rosemary Heights Counselling would be for them?
Right. No, I think that's a really reasonable question. I think there's a lot of various terms out there, especially with social media these days. It's a blessing and a curse because there's lots of access to great information and valid information, and then there's a lot of confusing and sometimes inaccurate information out there. And so the term we use in British Columbia is Registered Clinical Counsellor. That means that individual has a graduate degree in counseling psychology, and that they are held by a code of ethics through the British Columbia Association of Clinical Counsellors.
Is there people that wouldn't have that designation?
Yes, there are.
There is,
yeah,
okay.
So there are a couple other designations, RTC, and there's one other one out there.
Okay.
And so those are different designations, and that's, I'm sure, very confusing for the general public. Then the term counselor and therapist are the same. They're kind of used interchangeably. There's not a lot of difference, although anyone can kind of call themselves a counselor. You can be a camp counselor, a peer counselor, a school counselor. And so the province is working towards a college for clinical counselors to join next year. And at that time, there'll be a lot more regulation around using specific terms. And in fact, our name is going to change from RCC to licensed psychotherapist. And so, there could be more confusion for the public.
Especially when they're trying to Google that and try and spell it correctly.
That's right, exactly,
Yeah.
exactly. So the term RCC will still be out there. The BCACC is still going to exist. Now, just to kind of flesh that out even further, you can also be a registered psychologist. And so a registered psychologist has a psychology or doctorate, and they can diagnose and assess patients, whereas we don't diagnose. We do some form of informal assessment, but psychologists are the ones that do the assessments. And they can also diagnose for mental health disorders.
Okay.
And then a psychiatrist is a medical doctor that has gone to medical school and then specialized in the field of psychiatry. And they often work in hospital settings or private practice settings, and they can prescribe medications, which a registered psychologist cannot, as well as diagnose. They don't do as much therapy, these days. A lot of it is kind of following patient care and prescribing medication and making medication adjustments.
Okay.
Yeah.
So what sort of things do you do at your clinic? Like what if someone's listening to this and they're saying, I've been thinking about approaching a counselor to I've got some challenges or some, I don't want to use the word hang-ups, maybe that's a bad word.
Flaws,
yeah, opportunities.
Yeah, growth edge.
Yeah,
Opportunities. Yeah.
I've got some opportunities. And so what are some of the things that people reach out to the clinic for?
Yeah, so there are 5 of us on the team, and we all have a different niche. 2 of us do youth counseling, and then 3 of us, and one of the things I'm proudest of on the team that we've really worked to develop over the last couple of years is our trauma therapy. And so we do EMDR, which stands for eye movement desensitization and reprocessing.
What the heck is EMDR?
Yeah, so that's a trauma tool it's been around for a very long time, since the 80s, but it seems to have grown in popularity. And part of the reason for that is that it is a science-backed trauma technique that is very effective in helping people integrate trauma.
And is it like, I'm trying to understand just the words, is it something to do with how your eyes move and how you respond to people?
Yeah, so essentially it uses bilateral stimulation of the brain to further integrate memories that the client deems to be traumatic for them. And the therapist will use sometimes their finger, sometimes noise, and the client is prompted to follow the finger with their eyes whilst they're talking about something that has been, traumatic for them.
That's so fascinating.
Yeah, it's fascinating. I don't actually personally do EMDR, but I have 3 people on the team that do.
Yeah.
And we get wonderful feedback around the level of change that people experience and the emotional integration that they have after engaging in a number of EMDR treatment sessions. So it's not just a one and done thing. It's something that is a collaboration that you work on for a period of time.
So is this something that exposes maybe the stories that they're telling themselves? Is it something that exposes how they actually feel versus what they're communicating out to the world? Or?
Yeah, it works on a deeper level to engage with those emotional blocks that people may be experiencing. They still remember the event, but let's say that the event has an emotional connection of they rate 10 out of 10, with 10 being high and 1 being low. When they're finished the EMDR treatments, they should be at a 1. So they remember the event, but the emotional, it's been integrated enough now that they're not emotionally upset or dysregulated when they think about the event. So it takes lots of training and practice, and so we have 3 people on the team that do EMDR, and that's a really important part of what we do. And then I think the other piece is I mentioned earlier, the couples therapy. So there are also 3 people on the team that do therapy, emotion-focused couples therapy, and then one of the 3 of us does somatic experiencing work as well, which both use the body and attachment to help people move through stuck points.
That's, when you say you have 3 people on the team for couples therapy, it reminds me of when I first got married, and the person officiating our wedding sat me down, and he had just gone through a terrible separation. Oh. So good time to sit down and encourage someone right before they're about to get married. But he had made a comment to me, and he said, if I could ever have invested in one thing that I think would have changed my outcome, changed the whole story of our marriage, it would have been counseling, therapy, to sit down and actually learn how to communicate with each other.
Yes.
And I would imagine that you would probably support that idea, but also so many people probably struggle with the idea of how do I communicate? Because what I'm saying doesn't mean that's what you're hearing.
Right.
And that's I'm guessing that's one of the biggest challenges that you see when people come in is they're either not being truthful with themselves, not being maybe truthful with their partner, but also the way that they've learned to communicate. It's like that game of telephone when we're kids, right?
Yes.
Like the message isn't coming through properly.
Absolutely. Yeah, I mean, whoever told you that, it's such a great source of wisdom. I think there is the idea out there still that going to couples therapy means your relationship is in crisis, and it's like the last stop before it implodes.
There's probably a lot of people that
Many
think
people.
that.
And I think there's been really an awakening in terms of individual work and growth work, and everybody's kind of working on optimizing themselves and that kind of thing these days. So the stigma with individual therapy is shifting. Less so with couples therapy, I would say. And so a big part of what I do, I kind of see myself as a relationship translator, that I've got two individuals sitting in front of me that both have perhaps unmet needs and beliefs about themselves and the other person, and they just want to be understood. And as you said, with the telephone game, it's sometimes much harder to get that from a partner, especially as dynamics get cemented over time together.
Right, and when you say dynamics, like having children would be a huge dynamic change in a relationship.
Yes.
And now everyone's got these different responsibilities and trying to learn how to cope with them and deal with them and help maybe some little people become adults. And I'm sure often you see those partners kind of start to separate a little bit.
Yeah, and that it's very painful for both parties to feel disconnected.
Yeah.
And people will come in, and this is where I think couples therapy can be so beneficial, is that as an outsider looking in, I can really start to validate the loneliness or the fear or the sadness that each party has regarding that disconnection. And just to say too that connection and disconnection we're always moving in and out of. And in micro ways, little disconnections happen all the time in relationships. So it's not if a disconnection is going to happen, but how are we going to get back to connection together?
That's so interesting. I've never heard anybody say it like that. So it's almost in my world, in like business entrepreneurship and whatnot, the whole idea of time balance. It's like, well, there's not really such thing as time balance. You're kind of in and you're out, and you're always working between.
Yes.
And being a business owner, you can appreciate that. So you're saying when people, there's connection, there's disconnection, but just those little micro disconnections doesn't mean you're disconnected.
Right.
It just means maybe you've drifted a bit far from the shore and you need to start paddling back towards it, sort of idea.
Right. And couples therapy can help you understand what is our process back to one another? What do we say? What do we do? What practice do we have in place to find each other again? Because there's no doubt about it. People are busy, people are stressed, people have a lot on their plates. And so how do we find our way back to each other in that?
I love that. When you think back of all the people in the community that you've been able to sit down with and help, is there any success stories that really stick out to you? One that you were so proud of, and maybe it was somebody that they came in and they were lost.
Mm-hmm.
They didn't feel heard. They didn't feel seen. They didn't feel understood. And by the time and it wasn't a one-day thing. So, but by the time by the time they came in and were able to feel heard and feel understood and maybe help explore why they felt the way and why they saw the world through their own lens. Is there any stories that stick out?
Yeah, I mean, I think, again, one of the misconceptions about being a therapist, people say to me all the time is, oh gosh, I don't know how you do that. You must isn't it hard to hear people's problems all day long? And my response is, I feel very honored to get to kind of witness and be that safe place for people, because there are times when people tell me something they've waited their whole life to feel safe enough to say out loud.
Yeah.
And so to me, there's something very sacred about that I still am in connection with today. And actually just this morning before I came, I had a client share with me about someone I had seen a long time ago and haven't seen for probably 15 years. And this current client of mine said, do you remember so-and-so? I know you were their therapist, and they wanted me to tell you that they're doing great, and they still kind of think back on their time with you where they felt really cared for. And he said, I just wanted to pass that along to you. I know you can't tell me anything about it, but he wanted you to know. And that was and I said to him, thank you so much for passing that along, because I think when you're in this profession, you really do care about the people you see, and you don't always know how things turned out for them. And so to have that full circle moment where this was someone I hadn't seen since probably 2017, and just to hear he's doing well, and it's a very satisfying part of the work.
What a compliment. I'm sure there's points at which you feel like you're almost part of the family, or at least with the people that you're sitting down with and having conversations with. I know for myself, like in my real estate business, when I'm involved at like one of the most stressful times of their
Yes.
lives,
Yeah.
right? And so by the time you come out of that, they invite you over for dinner every weekend, sort of thing. And it's
Yeah.
really incredible to be part of someone's journey like that,
Yes.
and see where they started and where they ended up.
Absolutely. I think that's what also people can forget is I'm with people through, adversity and challenge and grief and their worst moments at times, but I'm also witnessing their successes and celebrating alongside them. So I'll have maybe a teen that I've seen, started seeing in 2013, 2014, and they'll send me a picture of their engagement, or I get wedding invitations, or just people celebrating. I celebrate their wins with them as well, and I don't think that's talked about very much.
Yeah, I'm glad you brought that up, because my mind wouldn't have gone there. We talked about people coming in, and I think we landed on the word opportunities, but
Yeah.
there's also performance aspects that people could come in and be a part of that as well. So like my mind's going to business as an example, but I don't have to go in because I feel like something's broken.
Right.
I can go in because I feel like I could be better, or I'm doing something great, but I know there's more.
Yeah, absolutely. I think people will come in and say, I'm working towards this career goal, but I know that I'm getting in my own way. I have performance anxiety, or I don't know what to do in a conflict, or I'm intimidated by my boss. And so we will work on what messages are you giving yourself that are amplifying that worry. And is that a false perception, or is that an imagined perception? It's likely not real. And so we really work on helping them fine tune their thoughts and kind of get to what's underneath those thoughts.
Yeah.
Too.
Well, you say that like a false perception, when people come in and or rather somebody listening to this, and the false perception, if you could grab everybody in South Surrey and White Rock and grab them by the shoulders and solve one of the biggest misconceptions that they have about what a counselor does, what would you share with them?
I would say many people think we listen, and that's just it. I listen to people all day long. That's a huge part of what I do. But the part of the job that I think people would be surprised to hear is that we're always tracking nonverbals, physiological symptoms of how people are presenting. I'm always thinking about what's this person's family of origin story, and how is what they're saying tapping into that. I'm listening for patterns. I'm giving lots of feedback to clients. We kind of have an agreement around how will that work best for you? Can I give you my clinical impressions, and how can I do that in a way that's the most respectful for you? So it's a lot about helping people understand themselves, hopefully in a new way, and providing clarity. And the listening is all part of that. But I don't just listen to people.
Yeah, well, I loved how you framed that too, because you act, when you were even suggesting the way that your process works, you said, can I give you my clinical impressions? You're asking for permission for them to share something as a professional with them. But if they're not ready to receive that, you can't just jump on them, right? Like you need to, it's that delicate dance that you have to walk every day with people to make sure that you have the permission to listen and help and offer ideas or different maybe viewpoints as you go through those conversations.
Right. And there's times too where, and again, this is having been doing this for a while, I think I've noticed myself evolving in my style, which is being honest with people about, how what they say or what they do could be affecting other people in their life based on my own experience with them.
Right.
And no therapist is perfect either. So there have been times, especially in couples work, where I have to apologize for someone may come and say, Melanie, that language didn't land very well with me. And I'm always so grateful when people have the courage to let me know that. And I can model how to repair when you've hurt someone's feelings, or maybe I've said something in a way that didn't work for them. And so I think as a beginning therapist, that's your worst fear.
Sure.
Right. And that's, of course, nobody wants to hear that. But it really, I think, speaks to the level of trust and safety you have when you work with someone for a while, where we can really do that in real time together. And hopefully that helps them out there in their relationships outside of the office.
Yeah, well, you're totally right. Like, words are hard. And there's so many, I've been living in this world of Chat GPT where I've got an idea or I'm trying to think of something, but I don't have the right word for it. And there was a time when we were in school growing up where we had to look through a thesaurus and try and figure out what the perfect word for the situation.
Yeah.
But words matter, but they're also hard. And everybody's human, and that's one of the challenges with communicating with people is being able to have the right word and to have it land in a way where they receive it the way that it's meant to be received, right?
Yes.
So it's and that comes with years and years and years of experience.
And being comfortable being human in the room. And I think, again, my own growth as a professional, being that you're very much connected to the process and sort of being professional at all times. And I still am, but I'm able to do that in a much looser way over time. And so you can self-disclose when appropriate, or you can apologize and repair with a client. It's just easier to do when you're a human in the room first and a professional second. You know?
Now, I know you've got a team of 5, right?
Yes.
You got a team of 5. When you think of your team, what is the thing that makes you the most proud?
I think compassion. I think naturally everybody on the team is not just empathetic, but they really care about their clients. And we do peer consults together, which is a standard practice in the profession.
And what is a peer consult?
It's saying, hey, I had a difficult session, or I had a difficult case today. Can you hear me out? And we'll talk about that. I did one with someone on the team just a couple days ago. So we really take care of the work in that way too. And I think, just the level of compassion and ethics that everybody has sets us apart.
That's awesome. That is something to be proud of. And is there anything else that you deal with that you see like on a regular basis, or for someone that maybe it's and I gotta apologize because the acronym has completely gone out of my head.
EMDR.
Yes, thank you.
Yeah.
So outside of that, outside of the couples therapy, is there other things that you find that people quite often seek you out for to come talk about?
Yeah, when we're looking at individual counseling, I would say grief and loss. And life transitions are the top 2 other ones. Anxiety and depression, of course, there's a lot there for people, and we all do that work. But I would say that the grief and loss, life transitions it can be anything from changing a career, a community move, becoming an empty nester, going through a divorce and separation, retirement. These are becoming a parent. Yeah. So these are kind of typical life transitions that we all often have to face. And so we do a lot of that kind of support, because there's loss. Loss is not just when your pet dies. Of course, that's awful for people too, but loss can be in some of those life transitions as well.
Yeah, and those are all like incredibly significant life transitions and changes for people. And I wonder how many people just think, I just need to buckle down and shove this deep down inside and never bring it up again. I know, like, as an example, when we lost our dog, and when I say dog, I never had appreciated people losing their dog before. And the reason I didn't is because the family dog had died, but it was kind of my mom and dad's dog, and it was never really my dog. And then I had this dog that was mine when I moved out, and she was always there. And I'm not going to go into it because I don't want to start tearing up. But I had never experienced a loss like that, and I'm very fortunate to still have my parents and that sort of thing. But I had no idea how to deal with it, and to this point, to this day, I still can't talk about it because I don't think I've accepted it, and you put it down. And Is that normal? Is that what a lot of people do in situations like that?
Yes.
And I'm guessing it's probably not the most healthy thing to do.
Well, it's a way of coping. I think I always say to people, in the short term, that can be okay. right? You still have to get up and do your job and take care of your family. So people need to do what they need to do to survive and get through something that is that difficult.
Like busy work, they just got to get their mind on
Sometimes,
something else.
Short term, I kind of always want to say, you have to do what you have to do. But if that's all you do, that's going to be a problem, because it doesn't go away just because you shove it down. It's still there.
Right.
And we do end up seeing people who, we call it piggyback loss, where they will go through a loss and they surprise themselves. I'm actually feeling okay. And yes, I get teary, or yes, I cry, or yes, I find myself ruminating and remembering the person or the thing. And then something small will happen that piggybacks on that other loss. And that's the thing that kind of opens up this well of grief for people. And then they are confused. Why am I so upset about this? And so that can be really confusing for people, but yes, it's quite typical. And I don't want to, grief is grief. We don't need to kind of pathologize it or judge it in any kind of way, because people do that in whatever way works for them.
Right.
But therapy can be a really good way to honor your own grief process. And it doesn't always look like crying either. So.
Yeah, it's interesting. Yeah, people experience it in different ways and show up differently when they're going through that.
Yes, and as a dog lover, I really understand what you're saying.
Yeah. Well, you start to empathize, right?
Oh, absolutely.
Yeah. What about, so there's someone watching this, there's someone listening to this, and they're ruminating right now, and they're thinking, I've maybe never showed up to a session like this to come speak with a professional because fear of being judged, embarrassment, maybe it's not for me.
Yeah.
What would you offer them? What would you say?
Yeah, I would say that we start with where you're ready to start. And I do a 15-minute consult call with every potential new client of the practice. And that gives me an opportunity to share with them a little bit about what we do, and understand that it's nerve-wracking to even make that call, and as a first step. So I always normalize that for people. And I say, once I determine who the best fit for them on the team is, give it a go, give it a try, meet the person and just be open to the experience. And if at the end of that hour you're still really nervous, you talk about that with your assigned therapist. And if 2-3 sessions later that you're still feeling like this isn't the right fit for me, that's okay, because therapists have all kinds of different styles and personalities that flavor the work, and my goal is to match that person with the right person for them above all else. The studies show that personal fit with your therapist has a really big impact on the outcome of the work.
Yeah, and so what about someone listening to this and they're thinking, "Oh, I'm stoic. I'm not human. I'm above average. I'm infallible. Unbreakable. You can't break my will. I have my problems, but I'll just shove it deep down inside until it explodes out somewhere."
Yeah.
Do you get people like that?
Yeah, and those people don't as often come to therapy, of course, but they do end up coming for other things. Let's say they come as part of a couple and they're doing couples therapy, and I can see that they're quite detached from their own emotions, and they believe that having emotions makes them weak. So that would be the kind of person that I would either recommend some individual work for, but I would really say, hey, this is the way you have of managing. Again, just because you don't feel your feelings doesn't mean they're not there. And just get really curious about how that came to be for them, and sort of normalize and that it's understandable they develop that, but that there are other ways to kind of learn to greet and meet and sit with your emotions, and because they are informing your life whether you want to admit they're there or not.
I love that. Yeah, and then you're also you're shining out, however, wherever you may be, there's other people experiencing that, and you have your vision of perspective.
Yeah.
But everybody you interact with every day has their visions of perspective as well, and
Right.
And now the question is, how do you want to show up? Right.
That's right.
Yeah.
And they're not necessarily wrong. Like we're never there sort of judging that how you're being is bad or not okay, but there might be a different way that may lend itself to you having a deeper connection with yourself or a deeper connection with someone you love.
Yeah, well said. Well, Melanie, it's been an absolute pleasure. What if I could do this for another 4 hours with you? This is so fascinating. If someone wanted to reach out and learn a little bit more, where would they find some information, contact information, be able to maybe take part in that 15-minute orientation or meet and greet, so to speak?
Yeah, the best way is to go to the website, which is www.rosemaryheightscounselling.com, and they can book a free consult call there on the website with me or call us directly. And we're also on Instagram. So just Rosemary Heights Counselling on Instagram.
That's awesome.
Yeah.
And we'll make sure all your information is in the show notes. I want to thank you so much for being on The Best Wife. I know you've helped so many people in the community, you and your team. And I've heard nothing but amazing things about what you do there and how you've helped people show up and probably the versions of themselves they wanted to start out to be in the first place. So thank you for being a part of our community and all the great stuff you do.
Thank you. It's been an absolute pleasure and lots of fun.
Awesome.